Now, all Kenyans will be required to register with the Social Health Authority that has replaced the defunct National Health Insurance Fund from March 1st, 2024. Kenyans will have 3 months to do so if they have to benefit from the new health insurance. Our health and science reporter, Gloria Milimu, spoke with the chairperson of the authority and now tells us what to expect about the upcoming exercise on new health scheme.
It is now official that you will begin making contributions to the new Social Health Insurance Fund beginning next month upon registering with the Social Health Authority that repeals the National Health Insurance Fund in an exercise that kicks off from March 1st for 3 months. The registration under the enacted Social Health Insurance Act of 2023, according to the Social Health Authority chairperson, Dr. Timothy Olweny, will commence after the ongoing public participation exercise to collect views on the regulations.
The documentation that will be required will be, for example, your national ID card. For those who are under 18, you will need birth certificates in terms of registering beneficiaries. But it's just those documents that will be required, and information will be collected. Most likely there'll be some biometrics that will be taken because that forms part of the process. We're going to use the same infrastructure that has been used to register people in the past.
Under SHA, members who are self-employed will be required to pay 2.75% of their income upfront annually, as opposed to remitting their premiums monthly, as was the case under the defunct NHIF. For salaried Kenyans, their respective employers will be required to make the deductions from their gross salary before 9th of every month. The new health scheme also introduces penalties for defaulters. Apart from not being able to access services, anyone who defaults on their payment will be slapped with a 2% penalty for the time period of which they did not pay before accessing services again, according to the chairperson.
In the past, what has happened is people have only tended to pay their premiums when they need to access service. And that is not sustainable because, for example, if somebody needs to access a service or undergo surgery, for example, that costs 100,000 shillings, you'd have somebody paying the 500 shillings a month for a few months, and then once they've accessed the service again, they default. And that is not going to be sustainable.
Dr. Olweny explains that under the new scheme, healthcare benefits will be accessed by members at all facilities accredited and duly licensed in the country, and that the authority will run one standard package for everyone, regardless of the level of their contribution, unlike NHIF that had a mix of schemes.
Once the new rate that applies to each individual is determined, then we'll be able to prorate the advance payment, since you must remember the funds under NHIF by operation of law are now vested with the authority. So I want people to be comfortable that kitty is one. It is not like they're separate accounts. All that happened is that the funds were transferred on a particular date, but the Social Health Authority now is a custodian of those same funds.
In what now seems to be a move to curtail cases of fraud that bedeviled the previous regime, the authority's boss explains that plans are underway to enhance fraud detection systems. They are leveraging technology to help flag these fraudulent activities before any payment is made. Gloria Milimu, KTN News.
Thank you, Gloria, for that. Now, has the Kenya Kwanza administration decided as a matter of